In this video, I'm going to address amblyopia, commonly known as lazy eye. In another video, I addressed strabismus. Hi, I'm Dr. Moshe Roth. I'm a developmental optometrist, board certified in vision development and vision therapy. The term lazy eye is used for both strabismus, meaning an eye turn, and for amblyopia. These are actually two different things, but they're both often called lazy eye. I'd like to clarify what amblyopia actually is. Strabismus is when one eye turns in or turns out relative to the other, and that's why it's often called a lazy eye. Amblyopia is when information from one eye or both eyes hasn't developed. This is the topic that we're going to address. In a different video, I addressed what an eye turn means, and I'd encourage you to view that. In this video, I'm going to address amblyopia, lazy eye. Why is amblyopia called a lazy eye? Amblyopia is called a lazy eye because the brain hasn't developed the wiring from the eye to the brain. There's actually nothing wrong with the eye. The eye itself is healthy, but the brain hasn't developed the wiring because there's a difference between the two eyes. And it's too confusing for the brain to try to put the two pictures, the one from each eye, together. It takes effort to turn off that blurry picture. Lazy eye, amblyopia, is not a problem of eye health. It's a problem of visual function, of brain function. A child isn't aware that they're not using one eye or the information coming from that one eye because that's their normal. So a child can't tell a parent, hey, I'm not seeing with one eye. What causes amblyopia? Whenever there's a mismatch between the two eyes, either because they're not pointing in the same direction, or if there's a big difference in the strength of the two eyes, that produces a challenge for the child. A challenge they try to figure out and solve so they don't have that mismatch. Refractive amblyopia means that we're not getting a clear picture onto the back part of the eye. Think of a picture that's out of focus. It's hard to see the details, so it's going to be hard to remember the details. Amblyopia falls into two main categories: refractive amblyopia and strabismic amblyopia. I'm going to explain each one. Refractive amblyopia can be vision that hasn't developed on one side or hasn't developed on both sides. Let me explain. You might ask yourself, what does vision develop mean? And what do we mean by vision never developed? Think of a flower seed. The seed has the potential to develop, but we need to create the right conditions for that to happen. We need to plant it into good soil. If it's in beach sand, it'll never grow. We need to have water. Without water, it won't develop. We need to have heat and sunlight, and without that, it'll never develop. Vision is somewhat similar. If we don't have a clear picture focused onto the back part of the eye, the retina, the back part of the eye, then vision won't develop. What is unilateral amblyopia? When there's a large difference between the two eyes, then the brain usually develops the vision from the one side that's closer to being able to see clearly without much of a prescription at all. The brain never gets a clear picture from the other side, so it just starts to ignore it. It never develops. Often, this really affects more than just the other eye. Since the two eyes don't develop together as a team, it then affects what comes into the brain. And it can affect the ability to read or catch a ball or ride a bicycle or ultimately drive a car effectively. It's like that flower seed that's planted into poor soil or doesn't get enough water. It just doesn't develop. It can be done, but it's much more difficult because the two aren't well coordinated. They don't work together as a team. When a child turns off the information from one eye in order to reduce that confusion, then the information from that eye doesn't develop. The two eyes may look as though they're pointing straight, and they may actually point straight, so it's not obvious to others that this person actually has a lazy eye. What's bilateral refractive amblyopia? In the first type of amblyopia that we just talked about, unilateral or one-eye amblyopia, it's different than when somebody has the second type of refractive amblyopia or bilateral amblyopia. When both eyes are very far-sighted, the back of each eye never gets a clear image. In this type of amblyopia, both eyes are termed lazy. It can make reading and studying a lot more difficult and frustrating. It may not be obvious when somebody's looking at that person because they may not have an eye that turns. And that's why it's so important to bring in a child early, similar to a well baby visit. Is there surgery for amblyopia? In refractive amblyopia, the two eyes are pointing straight. So there's no surgery for amblyopia. Some doctors do surgery for strabismus, an eye that turns, but even that rarely works. And although the eyes look straight in the beginning after they've had strabismic surgery, it's common for the eye to go back and turn again. Why? Because the problem isn't in the eye, it's in the brain. The brain is what controls where the eyes are pointing. Strabismic amblyopia. The third most common form of amblyopia is due to strabismus. Strabismus means that one eye is pointing straight and the other eye doesn't point in the same direction. It might be pointing in or out relative to the other eye. Here too, it's difficult to put the two pictures, the one from each eye, together, so a child learns to turn one picture off. And then ultimately, the vision from that side, from that channel, doesn't develop. When vision doesn't develop, then it's very hard for somebody to judge depth or how far something is from you. If someone doesn't develop depth perception, it's hard to catch a ball or to judge distances between cars when driving. If a child has difficulty using the two eyes together, then they don't want to do team sports such as soccer or baseball because it's hard for them to tell where the ball is and where to position their arms or body in order to catch the ball. I might get hurt, either physically or emotionally, when the other children may laugh at me. It then causes someone to get into an accident or to have trouble parking a car. It can cause someone to be clumsy. More importantly, it can affect how someone reads. So it can affect how someone does in school and how they feel about themselves if they don't do well in school. I hope I've given you some valuable information and have helped simplify a complex issue. We're just hitting some of the highlights in this video. How can we solve amblyopia? Fortunately, there are ways that we can help someone if they have amblyopia. It's best to solve amblyopia, lazy eye, in childhood so the child can succeed in school. But we can also help adults who have had amblyopia for a long time. I often hear adults say, "Oh yeah, I was told to patch one eye when I was younger, but I never did." Well, that's okay, because the good news is that patching never really works long-term anyway. If you think about it, the goal is to get the two eyes to work together as a team. How does patching one eye help the two eyes work together? The fact is, it doesn't. The hopes are that once we remove the patch, the two will somehow work together. But that never really happens. It's like teaching somebody how to play the piano by just having them use one hand at a time. If you never practice using the two hands, you're never going to be able to integrate the two effectively. When you catch a ball, in the beginning, you learn how to use the two hands together. There are, however, many eye doctors that still prescribe patching, even though it isn't effective long term. Vision therapy, prisms, special therapeutic contact lenses, and syntonic phototherapy are ways that we are able to help somebody gain or regain the ability to use the two eyes together as a team. Please consider calling our office at 732-679-2020 and scheduling for an examination. I'd be happy to help. My name is Dr. Moshe Roth. I'm a developmental optometrist, board certified in vision development and vision therapy.